You want to know more about acute diarrhea, right? You're in the right place. Without further ado, let's go. Hi everyone, I want to talk about acute diarrhea, types and causes. This will be acute diarrhea 1, which means there'll be other videos on acute diarrhea after this. Okay, let's go. Diarrhea is defined as the passage of loose or watery stools at least 3 times in 24 hours, or the stools that shows increased water content and perhaps due to decreased absorption or increased secretion. Acute diarrhea is defined as diarrhea that is occurring within 14 days or less than 14 days. Persistent diarrhea, on the other hand, is diarrhea that is troubling an individual for more than 14 days but less than 30 days. While chronic diarrhea, on the other hand, would be diarrhea that has occurred for more than 30 days. That's what we call invasive diarrhea. Example is dysentery, and that will involve diarrhea with stool stained with blood or mucus. That will also be associated with fever and abdominal pain. That's what we call functional diarrhea. That is, after all possible causes have been eliminated, then we can come down with a diagnosis called functional diarrhea. It is a diagnosis of exclusion. Secretory diarrhea, on the other hand, means you secrete electrolytes into the intestinal lumen, and that is caused by bacteria or parasites and sometimes by virus. It may be secondary to medications, might be as a result of genetic factors, celiac disease, or inflammatory bowel disease. Bile acids, laxatives, hormones, and poisons have been implicated here. Osmotic diarrhea is after eating or drinking non-absorbable substance. Inflammatory diarrhea is everything about ulcerative colitis and Crohn's disease. You can check my channel for ulcerative colitis and Crohn's disease. I've made separate videos on each. Infective diarrhea, needless to say that I'll go over that extensively here. So don't worry, we'll talk more about bacteria, virus, and parasitic infection. And irritable bowel syndrome is a separate topic for another day. While going through different types of diarrhea the other time, when I came to infective diarrhea, I said I'll be talking more about that in a bit. Now, I will start. Infective diarrhea's example here is viruses. Viruses will cause watery diarrhea. And prominent among the viruses that could be involved here will be norovirus, sometimes called Norwalk because it was detected in Norwalk, a community in Ohio State. It's sometimes referred to as winter meeting disease or stomach flu because it's very common in winter times. Could be acquired through ingestion of contaminated shellfish or through restaurant food or sometimes even homemade food. Vegetables could be the source of transmission here and is responsible for major cholera outbreaks at daycare centers, schools, group homes, cruise ships, or barracks. You can also have rotavirus or enteric adenovirus, astrovirus, or sapovirus. They could be acquired through contaminated food and water with feces. It's also responsible for some outbreaks at daycare centers and gastroenteritis in children. It is found mostly or The effect is more pronounced in immunocompromised adults. Clostridioides is formerly called Clostridium difficile. It's now called Clostridioides difficile. That is secondary to antibiotic use. Okay, so it's very common among hospitalized patients, patients taking chemotherapy, and patients who are on antacids. Also common among inflammatory bowel disease affected individuals like ulcerative colitis or Crohn's disease. Clostridioides difficile, formerly known as Clostridium difficile. When you are taking antibiotics for a long time, the doctor will be suspicious of this. If you come down with diarrhea, or you're on chemo, you're in hospital, taking antacids, watch out. Clostridium perfringens will occur within 8 to 16 hours of contact with the agent. It's found in meat, poultry, gravy, home canned foods. Enterotoxigenic Escherichia coli will manifest after being contacted within 1 to 3 days. It's gotten through contaminated water or food with feces. And there will be history of recent travel here, particularly if you are in a clean, advanced regions of the world and you are down with enterotoxigenic Escherichia coli. It means you have probably traveled to a region with poverty and endemicity of this particular agent. So history of travel is very important. When someone comes down with diarrhea, but they don't know the cause yet because you could have acquired it, particularly enterotoxigenic E. coli. Giardia lamblia, the effect will manifest within 7 to 14 days. It's gotten through fecal contamination, could be found in daycare centers, swimming pools. The history of travel is very important here. Hiking and camping, particularly if you have found yourself in beaver's residence. You can pause and go through this. Cryptosporidium parvum, effects will come up within 2 to 28 days. Acquired through contaminated vegetables, fruits, unpasteurized milk, found in daycare, as well as swimming pools and recreational water resources. Mostly gotten from animal exposure and common with HIV having chronic diarrhea. Cryptosporidium parvum in HIV affected individuals with chronic diarrhea. Listeria monocytogenes. Perhaps you've gotten this on the news many times. It's going to cause one-day gastroenteritis. So if you contact it today, you're going to come down with the disease the following day. It's found mostly in processed meats, hot dogs, soft cheese, baked, and fruits. It was in pregnant women and immunocompromising state, and of course found in extremes of age, that is, the very young and the elderly. Cyclospora cayetanensis, 1 to 11 days, found in berries or herbs, can cause chronic diarrhea in HIV-infected individuals. Okay, when it comes to bloody stool, and the bloody stool is associated with fever and mucus, then we have a lot of agents to think about. First, non-typhoidal salmonella. Incubation period 1 to 3 days, could be found in poultry, eggs, egg produce, fresh produce, meat, fish, unpasteurized milk, juice, butters, spices. Animal contact, example, petting zoos, reptiles, live poultry, and other pets. Also, travel to poor areas could be the main reason or the root of contact. That is salmonella, non-typhoidal salmonella. Campylobacter species also cause bloody stool, and it could be acquired through poultry, meat, and unpasteurized milk. Gala species within 1 to 3 days when you have ingested raw vegetables could also be found in daycare, overcrowding environment, and common among homosexuals, particularly men to men, and also very prevalent in poor environment. Enterohemorrhagic E. coli, 1 to 8 days for incubation, found in ground beef, milk, other meat, fresh produce, juice, daycare, outbreak, nursing homes, elderly, and very young. The senior species, 4 to 6 days, found in pork products, untreated water, abnormal iron metabolism, liver cirrhosis, hemochromatosis, blood transfusion, thalassemia, and sickle cell disease. The senior species are treated with abnormal iron metabolism. Fibroparahemolyticus. Patient is 1 to 3 days, found in raw seafood, shellfish, liver cirrhosis. Entamoeba histolytica, 1 to 3 weeks after being contacted, and fecal contaminated food or water. And the history of travel to poor environment is very significant here because it's not very common in advanced countries with clean water and food. Okay, with that, I've come to the end of the first video as far as acute diarrhea is concerned, and we'll be talking more about symptoms and diagnosis, then later on the treatment in subsequent videos. Thanks for listening to my presentation. Kindly subscribe to my channel so that you can get these presentations immediately they are published. Thank you. I appreciate it.